Proposition 8 has been an uphill battle for the 2018 election thus far. With this possibly affecting so many lives, some people have strong opinions.
About dialysis. Treatment for dialysis is paid for by a couple of different sources. The federal Medicare program pays for treatment for the majority of people on dialysis in this
With
state.
this possibly affecting so many lives, some people have strong opinions. CEO of Henry Mayo Hospital, Richard Severe, gives his perspective on what the prop means to patients in California.
Well, the real danger that we foresee is that with arbitrary limits on the cost of healthcare in California for dialysis, that eventually the major providers of outpatient dialysis services would leave the state.
With this proposition possibly affecting hospitals and clinics, staff nurse at Santa Clarita Kidney Center, John Wilson, speaks out as well.
Well, if they didn't go for dialysis 3 times a week for this certain amount of times, they could have buildup of fluid around their heart and in their legs. Their potassium, which is very dangerous, could build up, and that ultimately would hurt them if they weren't on a routine dialysis schedule.
This proposition not only puts patients who fight for their lives with the battle of dialysis daily in danger, but also the potential lives of patient care in general. Dialysis survivor Chris Kessel gives us a live testimony as a dialysis patient.
I myself was on dialysis, and my bill every single month that was charged to my insurance was anywhere from $85,000 to $90,000 a month. The patient who's doing hemodialysis, and again, I don't have any first-hand facts of this, but their cost is going to be different than mine. Somebody else who was doing the same exact treatment that I was doing at home, but had more medications, more physical issues than I had, is going to cost more money because they have to have more treatments, they have to do more than I had to do. So there's no way that a bill can address in a cookie-cutter way how much it's actually going to cost to charge for dialysis.
As this race comes to a close end, this proposition heats up as a never-ending battle. For Cougar News, I am Candace Williams. For more on this subject, visit www.cougarnews.com and visit all social media platforms.